So what is arthritis? Arthritis is the swelling of joints and tenderness of one or more joints. Joints are places in your body where two bones meet. But some joints naturally wear down as you age. We have types of arthritis that happen after injuries, and also certain health conditions can cause arthritis. It can affect the hands and wrists, the knees, the hips, the feet and ankles, the shoulders, and the lower back. We have types of arthritis, which is the osteoarthritis, rheumatoid arthritis, juvenile arthritis. This affects children under the age of 16 years and is more common in girls. So what is osteoarthritis? This is the most common type of arthritis, and it is called the degenerative joint disease because it results from the deterioration of the bones and the cartilage that make up the joints. It results in damage due to wear and tear on the cartilage of your bones. Osteoarthritis occurs when the cartilage of a joint erodes or breaks down. It affects near bones, which one can become enlarged in pieces and are called bone spurs or osteophytes. Symptoms of osteoarthritis: pain, stiffness, bony enlargement, and swelling. Diagnosis: we have the X-ray testing. X-rays of the affected joints can detect osteoarthritis and also exclude other causes of pain. We have arthroscopy. This is a surgical technique whereby a doctor inserts a viewing tube into the joint spaces. Abnormalities and damage of the cartilage and ligaments can be detected and sometimes be prepared through the arthroscope. We have the ultrasound, MRI, and the CT scan. Treatment: weight control, heat and cold therapy. Heat should be applied at a comfortable temperature, and the heating pads are used over the muscles adjacent to the joint. Cold can lessen the pain in a sore joint by numbing the local tissues. We use the ice packs or reusable packs, and they should never be placed directly on the skin because they can cause damage. Instead, they should be wrapped in a towel before they are applied. We have pain medication, e.g. the analgesic medication. These are the over-the-counter drugs. We have topical analgesics. These are the creams and ointments. We have the non-steroidal anti-inflammatory drugs. These reduce both pain and swelling, e.g. brufen and diclofenac. We have muscle relaxants and some antidepressants. We have passive modalities, which includes massages, ultrasound, and electrical stimulation. We also have injections to the joint and also surgery. This is the total removal of the painful joint, which is exchanged for an artificial joint. We have the rheumatoid arthritis. This is a disease in which the immune system attacks the joints, beginning with the lining of the joints. It is also a chronic inflammatory disorder that can affect more than just your joints. It can damage a wide variety of blood systems, e.g. the skin, eyes, lungs, heart, blood, and blood vessels. It is also an autoimmune disorder. Unlike the wear and tear damage of osteoarthritis, rheumatoid affects the lining of your joints, causing joint swelling that can eventually result in bone erosion and joint deformity. Severe rheumatoid can cause physical disabilities. The symptoms of rheumatoid: tender, warm, swollen joints, joint stiffness that is usually worse in the mornings and after inactivity, fatigue, fever, and loss of appetite. Also, as it progresses, symptoms often spread to other parts of the body, e.g. the wrists, the knees, the ankles, the elbows, the hips, shoulders, skin, eyes, lungs, and heart. Also, the kidneys can be affected. What causes rheumatoid? Rheumatoid is an autoimmune disease, hence it affects your immune system. The causes are not known, but a genetic component can be a factor issue. Environmental factors such as infections of certain viruses and bacteria can trigger the disease. What are the risk factors? Your sex. Women are likely than men to develop rheumatoid arthritis. Your age, it can occur any age, but the common begins in middle age. Family history. If a member of your family has rheumatoid, you may likely be at risk. Smoking. Cigarette smoking increases your risk. Excess weight. People who are overweight appear to be somewhat at a higher risk. Complication. We have the rheumatoid nodules. These are firm bumps on tissue, most commonly formed around pressure points such as elbows, and they can also form in the body, including the heart and lungs. We have dry eyes and mouth. People who have rheumatoid are most likely to develop Sjogren syndrome. This is a disorder that decreases the amount of moisture in the eyes and mouth. We have infections, heart problems, lung problems, and we also have lymphoma. This is a group of blood cancers that develop in the lymph system. Diagnosis. Rheumatoid arthritis can be difficult to diagnose in its early stages because the early signs and symptoms can mimic those of other many diseases. During the physical exam, the doctor can check your joints for swelling, redness, and warmth. Also, your doctor may check for reflexes and muscle strength. Also, blood tests can be done. Imaging tests such as X-rays and MRI. The treatment. There is no cure for rheumatoid arthritis, although clinical studies indicate that remission of symptoms is more likely when treatment begins early with medications known as disease-modifying anti-rheumatic drugs. This medication depends on your severity of your symptoms and how long you've had rheumatoid. We also have the non-steroidal anti-inflammatory drugs that can relieve pain and reduce inflammation. We have the steroids reduce inflammation and slow joint damage. We have conventional disease-modifying anti-rheumatic drugs. This can slow the progression and save the joints and other tissues from permanent damage. We have therapy. Your doctor may refer you to a physical or occupational therapist who can teach you exercises to keep your joints flexible. We have surgery. If medication fails to prevent or slow joint damage, you and your doctor may consider surgery to repair damaged joints. Surgery may help restore your ability to use your joints, and it can also reduce pain and improve function. Some of the procedures are synovectomy, surgery to remove the inflamed lining of the joint, e.g. the synovium. It helps reduce pain and improve the joint's flexibility. We have the tendon repair. Inflammation and joint damage may cause tendons around your joints they may cause damage around your joints and to loosen or rupture. Your surgeon may be able to repair the tendons around your joint. We have total joint replacement. This is when your surgeon removes the damaged part of your joint and inserts an prosthesis made of plastic and metal. We also have clinical trials. The management, lifestyle and home remedies, exercise regularly. Gentle exercise can help strengthen the muscle around your joints. Apply heat or cold pads, relax, and also there's alternative medicine which are fish and plant oil. The overall management for arthritis is don't lie on the affected side, don't sit for too long, don't stand for too long, don't carry heavy loads, avoid being overweight, keep warm, select your shoes carefully, avoid heel shoes that are too high and hard, choose shoes that lace up and provide your feet with comfort. Although arthritis is a dreadful illness, it can be prevented by maintaining a healthy diet, regular exercise, and a stress-free life. Also, we can pray to God because He's our great physician and our source of strength, and is able to heal all manner of diseases. Also, joining a support group can be of benefit to us. Thank you for your time, and may you have a blessed Sabbath.